So once again, welcome all of you. Thank you for joining in. Thank you for your time on Sunday morning. And we are here to talk about the most hot topic, which has been on everybody's mind and has been bothering most of us, rather the whole world. We are here to talk about on how to handle mild and asymptomatic COVID cases at home. So this is also my experience that we have seen that 80% of the cases in today's world are those which can be handled at home and people can easily get recovered and get back to a normal life in about 10 to 15 days. So I think this is a very important session for each and every person um, on earth today, that they should know as to how to take care of themselves and also how to take care of a patient in the family in case there is a COVID case in the family. So, of course, it's quite an honor to see so many people have joined, but those who could not join or are not able to, could not join for this session, we can always share the recording with them, because this is going to be a very, very, very informative session, let me warn you. Okay. So let's get started. I'd first like Dr. Nina to introduce herself, and I'd also like her to tell us what to expect from this session. And over to you, Dr. Nina.
Hello, good morning, everyone. I'm Dr. Nina Pais, and I'm a family physician since the past 31 years. And now we are treating COVID cases. We treat only cases that are mild and asymptomatic, because there is a level of oxygen saturation that we need to watch for. So how do you decide who is a mild or an asymptomatic case? A mild case is a patient who has respiratory symptoms with or without fever, without shortness of breath, that is no respiratory distress or breathlessness, but also having an oxygen saturation of more than 94%. So what I'm going to discuss today, or what the conversation we are going to have today, it's going to be an interactive conversation. And what we're going to have today is to discuss and talk about how you can handle COVID at home. What are the different tips you can get from this on how you manage either your loved one who is having COVID, or if it's yourself, what are the things you need to do? Because when you go to a doctor, if you have all this ready, it makes it much more easier for the doctor or the physician to take care of you better. Because these days, everyone is rushed for time with the burden of a lot of patients. I wouldn't really call it a burden, but there is an excess load of patients. So when you have so many patients, we really, if the patients are more informative and more honest, it becomes very much more easier for us to handle patients.
Very well said.
Thank you. And if there is anything else that anybody needs to ask, please feel free, because I'd like to clarify as many doubts as I can. This is all from my own personal experience as a physician, as a family physician.
Absolutely, doctor. And I'm expecting a lot of people having a lot of doubts once we get started. We might fall short of time. So without much ado, let's just get started. First and foremost, doctor, I'd like to understand, how does a person really get to know? How does it strike in his mind that he could be COVID positive, and what are the symptoms that he should be wary about?
The first thing is, ask yourself, have you been in contact with anybody? Have you been careless through this pandemic? It is very important that we continue using, we have heard these messages over and over again on our phones, which tell us to mask up, wash our hands, and keep the 6-foot distance. If you have followed all that and you haven't been meeting people, then there's a high chance that you might not be contracting COVID at all. It could be due to a different cause. But if you have been maybe a little careless, not, I wouldn't say on purpose, but maybe you needed to do some jobs that you had to go out and you had to meet people, then there is a chance. And if one of your contacts was COVID positive, yes, there is a chance. I know each of us we need to go out, we need to pick up our stores. We don't know where we'll pick it up. And being so infectious, especially when we are in the second wave, that would be the first red flag if you start with the following symptoms. What are the following symptoms? The following symptoms are all respiratory tract infection symptoms, the upper respiratory tract, or even lower. You would start with a cough, cold, fever, headache. Occasionally, people have chills, sore throat, body ache, weakness. And in this second wave, we also see loose motions and nausea, which we didn't see in the first wave. So in this wave, we are seeing those which are additional symptoms. Weakness is a big weakness, fatigue, loss of smell, loss of taste, pain behind the eyes, just like any other viral fever. But the spread is more rapid here. So those are the symptoms you need to watch for.
Okay. And it's very alarming to know that symptoms have increased from the last 1 year. People are seeing different kinds of symptoms also now. So we need to be very careful about that as well.
Yes.
Okay. So once a person understands that he could be COVID positive, there is a probability there. What is the immediate thing he or she should do?
The first thing I would advise you is to contact your family physician. Your trusted family physician who you have been going to for years knows you very well and knows whether it could be an allergy or something else. That is the person you need to go to. Okay, you feel that your family physician cannot handle it. Then you contact your neighbors and friends and ask them who they are, because COVID is almost in everybody's house. So ask somebody who would be a good person they would recommend. Please go by a recommendation and go to a doctor who knows what they are doing.
Okay. So that should be the first thing we should do. We should contact our family physician. Okay. So nowadays, the recent news is, doctor, that there is a kit available that a person can self-test him or herself, and we needn't even go for the RTPCR test outside in case, of course, we are feeling the fatigue and we are probably not in a condition to go. So what are your thoughts about this kit and how accurate is it? Can you please tell us about it?
Yeah. Yes, the RAT test or the rapid antigen test is okay. It is not very accurate, but we use the RT-PCR test as the gold standard. So the fact that you have already come to the doctor shows that you have some symptoms, and invariably I would have asked for an RT-PCR test. It's okay, what you're doing at home is fine. But even a positive test is definitely a positive, but if it is a negative test, it means that you still need to do your RT-PCR. So what we do is when they come to us, we always ask for the RT-PCR because we don't want to waste time. It is very important for us to treat on time. And so we would definitely go with the RT-PCR test, which is a nasal swab and an oropharyngeal swab.
Okay, so which means even if the person is doing a RAT test at home and if it is coming negative, then it is surely recommended to go ahead and get the RT-PCR test done. Hello, Dr. Nina, I think your video is frozen. Dr. Nina, are you with me?
Yeah, I just lost you for.
Yes, we lost you for a bit.
Could you please repeat what you said?
Oh, I was just saying that in case the RAT test comes negative, then a person should go outside and get an RT-PCR test done. So the home kit is or could be to some extent not accurate.
Yes.
Next thing I would like to ask you is, of course, if one gets tested positive, unfortunately, so then to make make a proper room for this kind of an uncertainty, what are the kind of devices we should keep at home, or what are the kind of things, or what should we be prepared with at home?
Yeah, okay. This is very important. I feel that during this pandemic, the things that every home should have is a pulse oximeter, because you never know when you are going to be affected by COVID. And at that time, you are not going to go running around searching for a pulse oximeter. So having a pulse oximeter, having a thermometer, having a steam inhaler, very important. Sometimes we need to have two sets. I mean, if there's one patient who's positive and the rest are negative, we may need to buy a second set for the people outside because we don't want anything being used by the person who's isolated. Besides these two devices, people who are hypertensive need to have a blood pressure monitor, and those who are diabetic need a glucometer at home because we need to monitor them at every stage. They need to be monitored if they contract COVID.
That's very important. And I'm hoping that with the kind of cases increasing, with the kind of age group that is getting affected in today's world, there is a proper kit that will be available, and you don't need to go and buy these small devices separately. So there'll just be a COVID care kit available that one can buy with a steam inhaler, thermometer, pulse oximeter, etc. And
that will be convenient. Yes.
Yes, very much, very much. So realizing that you have COVID now, I'm sure it is physically, of course, you are going to be impacted, and we may probably the tablets are going to be helpful over there, which your physician prescribes. I'm more concerned about how will the psychological state of the patient be, and how does the patient handle that?
It is something that we see on a day-to-day basis. The first thing that happens, you hear of others getting COVID, you panic a little bit. But when COVID comes to your house, there's utter chaos, utter panic. It is not only the patients, but also the relatives who go into panic mode. So the first thing I'd like everyone to know, what is happening? I think the Zoom is getting cut.
What happened?
I don't know. I got a message to continue Zoom. I think our session is...
Okay, we're all good.
Okay, fine. Okay. Yeah, I was talking about the panic mode. Everybody goes into panic. Everybody goes into a frenzy, and most often people can't think straight. So the first thing I want to tell you is 80% of the patients are asymptomatic or mildly symptomatic, which can be handled at home. So the first thing you do is contact your doctor, but just stay off panic and stay calm, because you are most likely one of the 80. So you start thinking positive and say, I am in the 80%. I don't need to worry. And if you go early, that is the ideal thing that all of us want. All of us family physicians and physicians want you to come in early because the disease is such that we can treat you very well in the first week. We divide the illness into 2 weeks, the first week and the second week. And the first week has a different set of medication protocols that we follow. And the second week is different. So my request to everyone is, please don't ask uncle, auntie, sister, cousin, friend, medical student on what to do. Please go to your own family physician and ask them, because your doctor can guide you the best. We get people who come in right on day 1 or day 2 or day 3, and we get people who come on day 7 or day 8 who have already taken medication. And then sometimes I wouldn't talk about anybody else's prescription, but they could be things that we could have used earlier in the day, which could have helped the patient. But of course, it's not in our hands. We can't really comment. I can't really say that is the right thing. I mean, that is what I feel. I feel sometimes we could have stopped it early. Sometimes they don't come to the doctor just because of the fear of COVID. They don't want to accept. So when you have COVID, please accept it. Say it's another illness that can be treated. And the earlier you come, earlier the treatment, and better the prognosis.
Okay, that's very important to know. So like you rightly said, we shouldn't panic, accept it. First, I think, like we all say, that when we go to the doctor, half our problem, already is gone. Medicines do work later on, but you kind of feel that you're in the right hands and you're going to be taken care, and that's the starting point of your recovery. Cool. And early detection, of course, that is also very important. You should not, let your symptoms go unnoticed. Please make a note of whatever you're going through and how many days. I think that is also important. Right. Okay, doctor. Moving ahead, I'll also like to ask you what could there be any triggers that the patient should be wary of? Of course, COVID has started and he or she starts counting the days. But do you think the medicines work normally and whatever the physician's uh, prescription is, it works normally, or the patient should keep waiting for or keep monitoring? And what are the kind of triggers he should be, wary about?
Yes, this is an important question. The main thing that I do with my patients is ask them for a follow-up. Every 2 days, I need to see them. And between those 2 days, that is because I'm watching them I'm watching them at regular intervals. When they have very mild symptoms, I may say, okay, I'll see you after 3 or 4 days. But between the time I see you, you need to do certain things for me to help you and to help me. One is you make a chart. You have one column where you write the time and the date, the second column with your pulse oximeter reading, the third column is with your temperature. And when you have this, if your pulse oximeter reading drops below 95, you need to let me know. If your temperature is 98, above 98.6, you make a note. If it is above 100, you let me know. And if you have any new symptoms, you have another column for any new symptoms. So on your next visit, you need to tell me, just give me a report of what has happened between those 2 days. When we watch a patient regularly, we are able to identify where we can intervene with what medication we need to give them.
And do you also think that if any kind of a test is not required in the beginning, there could be a test required later after like 5 days, 6 days?
Definitely. There are blood tests. When they are very mild, we don't do many blood tests. We keep watching them. But sometimes, most of the problems start after the 5th, 7th, and 10th, around the 5th, 7th, and 10th day. So that is the time when the problems occur. So we keep watching them all the while. And your physician may ask you for a blood test on the 5th day or the 6th day. Please get it done. It is very important because those are markers. Those are markers which help us to identify what is your status. And if you need any intervention, if you need to be seen by, you need to get into a hospital, we will tell you early so that you don't go at the end. We hear of people as soon as they panic so much that as soon as they hear that they have got COVID, the first thing they want to go is go and get an oxygen cylinder and keep in the house. Most unnecessary. You're not going to reach there. Imagine and believe that you are in the first 80%. So you're not reaching there. You leave that oxygen cylinders on all those devices to be handled by the hospital. You just take care of yourself. You need to take care of yourself during this period.
That's right. Very well said, doctor. And I'm sure people in the audience are getting enlightened. I'm sure many of them are now relieved to some extent that if they are one of the 80%, they definitely don't need to panic, and there are ways to cure this, life-threatening disease as well. You can fight it. All right. Moving ahead, doctor, I'd also like to ask you. Just to conclude till what we have discussed. The temperature levels, the SpO2 levels, the kit that we were talking about, the kit that we bring home. So we keep monitoring on a daily basis and let our physician know that we are not doing fine or we are doing fine. And that's how it goes ahead. So do we do it for a span of 10 days or like 7 days?
Yes,
8 days?
yes,
okay.
Definitely. Because there are times when the fever comes back after 7 or 8 days. You have 3 days of fever, you have a gap, and there are patients who may start off with a fever later. We need to monitor them. And it is not just one reading that you take in a day. You take 3 readings. 3 readings of your pulse, your oxygen saturation, 3 readings of your temperature. You take this 3 times. I tell them to take it 3 times before food because they will remember that. And also anywhere in between, if you feel that your temperature has gone up, take it, note it down, inform your doctor. If you're feeling breathless or you're feeling, now breathlessness can be due to oxygen, a reduction in oxygen saturation. It can also be due to anxiety. So your doctor will be the one who will be able to identify that. So please contact your doctor. Don't panic. If you feel a little breathless, don't panic. I have so many patients who do feel breathless, but very often it is due to panic. They're so panicky, so worried. So you just need to calm them and reassure them, say your oxygen level is fine, you'll be fine. They just need to hear that. Once they hear that, they calm down and they are okay. They don't need to worry after that.
Right, right. And I'm so concerned about people who are a little bit weak from the inside, and they could just burst out crying, and it would be very difficult to, control them. Yeah.
Yeah. Yeah, but we are there. We are always there to help out and to reassure them. The basic thing is don't worry, trust your family physician. Trust your family physician and don't worry. Don't.
That's right. Great, doctor. Thank you so much for enlightening us. Doctor, for some reason, I see your video is frozen. Is it just me, or is it everybody who is experiencing that? Okay, now it's fine. Okay. Now it's good. No problem. We are all good. Let's move ahead with some more important questions. So another question I had, doctor, was if the patient is alone at home, if probably the whole family has got COVID and they do not have any external help. And so in this case, can the patient step outside for buying medicines or getting any medical tests done? Can they self-drive themselves, or can they use a public transport? What should that kind of a situation, how should it look like?
That's an absolute no. Absolute big no. Because if you do that, you are putting so many other people at risk. And if they pick it up, they're going to take it back to their families, and the spread is going to be vast. It's just going to spread. Please do not do that. Most often, I have seen families getting infected, and most often in a family, everybody is not too sick. There will be one or two people who would be a little stronger than the rest. If you can manage at home, then those people need to run the house. Run the house, and bring down all the physical activity to the minimum. You contact your family, friends, societies. There are a lot of people out there, a lot of angels out there who are willing to help. People are just coming forward. We see so much of goodness in people coming forward and wanting to help. Just call up. Don't feel bad to ask for help. This is a time for each of us to help each other. Please ask for help. There are people who supply food home for COVID patients. But my basic thing is, when you don't want, everybody's being good to you, you don't want to pass it out. So even the medical stores or whoever, you could have somebody outside monitoring and getting things and leaving it at your doorstep. And only after they go away, one person can go out, pick the things and bring it in. But I would definitely advise you not to come face to face. You want to thank them on the phone. Whatever you want to do over the phone. For these 14 to 17 days, please stay put inside your house. And no, you should not be going out and coming in contact with anyone. When we speak about this, I also like to mention, we are seeing people, when there is one COVID positive patient, all the rest of the family become primary contacts. You are not. Primary contacts have to be in isolation as well. Please do not think that because you are COVID negative, you can go out and you can buy things and come back. You are again putting other people at risk. So if we want to stop the spread, these are the places where we can contain it, where you stay at home and help out, get somebody else to try. Look, in most of the metros, most of the cities, we do have delivery services. Please, you make use of that. This is the time you need to make use of that. And try to bring down your physical activity to the minimum, because you need the caregiver needs a lot of energy to look after the person who is not well. Very often the caregiver is very stressed out because it's an extra burden of work they do it with love. I don't doubt that, but we need to think of the caregiver. We need to allow the caregiver to have a little time to relax, to breathe, so that they are able to give the best care to their loved ones.
That's right. That's right. All right, doctor. So in case, of course, something has to be brought home, that's fine. But in case the patient has to get a medical test done?
Usually, if it's a blood test, what we are doing here in Bangalore, which is we have the conveniences of the laboratories sending their people home. So the person could be allowed into the first room to just take your blood or your swab and go out, or you can sit outside. If you're in an apartment, it becomes a little difficult for you to step out because then you're putting other people at risk. So it could be just, they could be just allowed inside the door, take the test, and they could move out. So that would be the most convenient way to handle that.
All right. So medical services are being provided at home, and that's a blessing for such patients.
Yes.
All right. So that's a very good thing to know that everybody has come together, and it's so beautiful to see strangers helping strangers. And I think this is the time we all are seeing a new normal, which is looking more beautiful than the previous normal, in my opinion. Okay. Sure, doctor. Moving ahead, I'd like to ask you what is the kind of food intake that a patient needs to consume, because this is also important for a caregiver as well as a patient if he or she is alone, or probably a couple, or the whole family.
Yes, that is one thing that I would like the patient to get very healthy food, which is rich in protein. Protein helps to fight off the illness. It helps your body to recover. So please have a high protein diet. The vegetarians can choose between soya, legumes, paneer, dal, and whatever is higher in protein. You can check out. I'm not a dietitian, but you could check out on Google and check out for the high protein foods. The non-vegetarians have a lot of protein foods like egg, meat, poultry, fish. So that would be for the non-vegetarians. That is regarding the food. They need to eat well. Very often they lose their appetite. If you lose your appetite, please mention it to your physician, because your physician could prescribe something to improve your appetite. Eating well is very important because many of them don't have a taste of smell or a sense of smell or taste, and that is not comfortable, and you may not feel like eating. But eating is very important. Keeping your body nourished, having adequate rest, sleeping. Eating, sleeping, and drinking plenty of liquids, very important. I will also tell you what you should not have. What I advise my patients not to have is anything chilled. This is not, it may be the height of summer. Please don't have anything chilled. Don't have anything that irritates your throat, because then we are going to confuse symptoms and your throat may take longer to get better. So avoid fruits like citrus fruits. I know there will be people who would say, yes, citrus fruits are good for you, but not at this time. I don't want anything to irritate your throat. So that would be no citrus fruits, no pineapple, no grapes. Anything that causes any irritation is a no. But things like papaya, banana, those are things that you can have. Or even if you have that and you have any irritation, please don't. So I would ideally advise you to avoid fruits, drinking plenty of liquids, hot water, honey and hot water if you're not diabetic, very important. A few more things is your steam inhalation, 3 times a day for the minimum, more frequently if you require it. Gargling if you have a throat irritation. If you don't have a throat irritation and you are very comfortable, then you can skip the gargling. But otherwise, gargling is very important. These are things that we advise all patients to do.
Okay. Doctor, looks like these are very basic and literally very basic things that people must have seem to have forgotten, that they have to be hydrated, they have to sleep well, they have to take adequate rest. Life has become so busy for most of them that I think this COVID is a kind of a reminder that you are human after all, and you got to take care of yourself first, and then your job will follow, your business will follow, and rest will just follow. Yeah.
Definitely.
Nice. That's very nice to know, and a good realization for most of them. So, doctor, of course, food is at one end, medicines are at other end. So how much of a role that do these two things play? Like, does food play a more important role, or does medicines play an important role? What's your opinion on this?
Both are equally important. You have to have your food, you have to have your medicines. There is no way you can skip either of them. So when my patients are not eating properly, it's a cause of concern for me, because I know that their recovery is going to get delayed. If you don't take your medicines correctly, then we are losing time because we need to control it at every stage. So every time you delay taking your medicines, we are losing time because it goes a day later or 2 days later when you visit your physician the next time.
Right. So all of you out there who think that I'll just have, probably a bread slice and then take my medicines and I'll be fine. I think this is an eye opener for all of us that you have to, of course, take your medicines, but at the same time have a proper, adequate diet as well. And that these two things combined is going to help you fight COVID. Right, doctor?
Yes, definitely.
All right. So looking at the patient's routine, how do you think from morning till evening, what should the patient do, like getting up in the morning till sleeping at night? How should the routine of a COVID patient look like at home?
Okay. The patient has got certain responsibilities. Okay, before I come to that, let me start telling you how we isolate a patient. If you have one patient who's isolated in a room, how does the caregiver manage outside? As I said, people panic and they just don't know what to do, and they do wrong things which could infect the other non-COVID relatives. So the first thing I tell them to do is keep a table outside the patient's room. Okay, so this is the table which is going to be the place where the caregiver keeps whatever the COVID patient requires from inside. The door, to have a patient in isolation, the patient should be in a room that has an attached bathroom. If you don't have that, it is very difficult because you're spreading the virus all over the house. But if you have the room and an attached bathroom, that is the ideal situation for a patient. So now next thing is you keep your table out there. The caregiver should know or be instructed that you have to wear a mask at all times and you need to keep changing your mask. And you need to use gloves whenever you're handling anything that is dealing with the patient. So what are the things that once the patient is enclosed in that area, it's not an imprisonment. It's going to be a time of rest for that patient. So I want the patient to know you're not being imprisoned. You're going to have a time of rest and you are going to relax during that time. You're just going to enjoy it as a nice, good holiday where you're a little bit sick, but you're being taken care of. But it's your holiday. So mentally, please be positive and enjoy the rest, your alone time. Just enjoy it. I'll tell you how to enjoy. I'll come to that a little later. But first, I'll tell you what are the things that are necessary for the patient inside that room. Inside that room, the patient needs what I mentioned earlier, the pulse oximeter, the thermometer, the steam inhaler. Very important. If you have diabetes or blood pressure, those are the two monitors you need inside. Besides that, in the bathroom, you require a bin, preferably a pedal bin, which is lined with a plastic. And anything that is used in this room which is waste, has to get into that. So that could be masks, which need to be changed. If they are soiled, you need to change them. You put them into that. It could be a food waste. Suppose a certain amount of food is given to you and you have wasted. I would like you to finish everything, but yeah, sometimes you would not be able to finish everything. You waste it. Okay, that has to be cleaned and put into that bin. And any waste, tissues, everything goes into that bin. It preferably a pedal bin. So it is, and when that bin is emptied, when it is kept outside, it has to be tied and kept outside. And it has to be, there are the government authorities who are accepting COVID waste. It is because of the number of cases, COVID waste is taken separately. So just be responsible that you don't get other people infected. So the patient keeps it outside the room. The caregiver uses gloves and a mask and ties it up and hands it over. If you're in a building and there's a society, they will tell you where the COVID waste goes. And if you don't have that, then maybe your society has to make arrangements for COVID waste. So COVID waste goes out. But what else does the patient require? The patient requires detergent to soak clothes and dishwash soap or liquid to be kept in their room, because to be taken when you get into isolation. The dishwash liquid is that every time you use your plate, you will wash it with hot water and soap. Wash it and rinse it thoroughly, and then leave it outside. And it could be covered with a towel or a serviette outside, and to be filled the second time for you to have your next meal. And your clothes. If you need your clothes to be washed, it should be soaked in hot water with detergent, with soap. So the soap will kill the virus. So a detergent and hot water for a minimum of 10 minutes soaked, and then you can keep that outside. And it can be used in the washing machine. But again, as I said, caregiver all the while masked and with gloves. So that is very, very important. Okay.
That's very
then you
important.
were asking. Yeah, thank you. And we'll go on to the next question of what you were asking about the patient's routine. Yes, the patient has a fairly busy routine looking after himself or herself. That would be checking the pulse oximeter, checking the temperature, and the steam inhalation in between. But besides that, the rest is the most important thing. You need to listen to your body. Listen to your body. If you are tired, sleep. Don't think, many of my patients who are very active say, Doctor, I've become lazy. It is not laziness. It's your body craving for you to rest, to recover. So please rest. I beg of you, please rest. That is what is going to help you recover. So take rest. And when you are awake, this is another important thing. Don't ring up to everybody around and tell them I've got COVID, and then you get people talking only about COVID. You are going to speak to only people who make you happy. It may be your relatives, your friends, somebody you've not caught up with. So in that small period of time when you are awake and you are feeling fresh, that is the time you're going to do non-sedentary activities. No activity that will involve any energy. All your energy is being conserved just to get better. So what would you do? You could watch some funny movies on YouTube. You could listen to some music. You could sing if you like, because you're not spending too much of energy. You could sing. You could watch a little TV. Now, you start watching a movie, you're tired, don't watch till the end. Stop and go back to sleep. Listen to your body. That is very, very important. So that is what the life of a patient inside the room is. You should be happy. When you come out, when you are there, you should be happy. When you get out, you should be happier. That's the way we would like you to be.
It's all about staying happy, whether inside or outside.
Yes.
Yes, that's so true. And I'd again like to thank you, Doctor, because going up to this level and explaining things, because these are the nitty-gritties that people might not be aware of. And this video, I'm hoping
I am against virus now that I've only gotten the first shot. But I do not go outside unless it's absolutely necessary.
Okay. First thing I'd like to say, look, really, that is not my topic. I will give you references where you could, at the end of the session, I will be putting up references and you could watch Dr. Gagandeep Kang. She's a virologist from CMC. The immunity that you get would be to keep you away from hospitalization and severe infections. If this does not permit you to go ahead and live life like you lived 2 years ago or 1.5 years ago, you still need to mask up, you still need to sanitize your hands, and social distancing is a must. No socializing like you used to socialize before. So the immunity is going to be there. The vaccines have been found that you need to watch for. If at any point you find that these symptoms come up, whether there's chest pain, breathlessness, drop in oximetry readings, increase in temperature, sudden increase in temperature, increase in cough. The cough should always be coming down, but if the cough does increase, you need to report it to your doctor immediately. Don't wait, don't try anything else. Just report it to your doctor and your doctor will handle it from there.
Thank you.
You're welcome.
So we also have a question from Manal Khan Sharif. And Manal, why don't you unmute yourself and ask your question?
Hi, doctor. How are you doing?
Hi, fine. Thank you, Manal. How are you?
I'm good, doctor. So nice to see you. Yes, doctor, both my grandparents tested positive 14 days back.
Yeah.
And I was the primary contact. I was looking after both of them. And my grandfather succumbed to it on the 5th day and he passed away. And
So
my
sorry, I heard about it.
Yes, my grandma is doing well. After the 8th day, I got myself tested and I've been on isolation for a week. So now
Okay.
I've not got any symptoms, but I want to know, do I repeat the RT-PCR test because it'll be my 14th day tomorrow and I will have to go back to my son and my family?
Okay, let me explain this, Manal. The
Yes.
basic thing about the RT-PCR, we use it only as a diagnostic tool. We don't use it as a repeat, repeat test after, because there is a reason. We don't use it as a repeat test. The virus, what the virology experts have given us to understand is that after the 10th day, the virus dies in your body. The virus is alive in your body for 9 to 10 days. And after the 10th day, the virus dies. But why does the body react even after the 10th day? That is a reaction to the dead virus. The reaction to the dead virus causes, depending on the viral load, if the viral load, when I say viral load, the amount of virus you have in the body, if the viral load is high, you react with symptoms of respiratory distress, of blood clotting, and all those different symptoms. The pneumonias all come with the reaction of the dead virus. So that is the reason we do not repeat the RT-PCR test. It is unnecessary. We have an occasional patient who does. We did in clinical practice, we have come across an occasional patient who had a positive report even after 10 or 14 days. And I got back to the lab and I asked them, how is this possible? And then the lab said, we are seeing a few cases which do come positive even on a second RT-PCR test. But that is because the viral load is too high, but the patient is definitely not infective. So with that assurance, I will tell you that there is no need for you to repeat the test at all.
Okay, so after the 14th day, then I can go back and meet my son, doctor.
Yes, definitely.
And any precautionary measures I'll have to take?
I would advise you to still continue using the mask while you are there for a week or two more, just as an extra precaution.
Okay, doctor. Okay, thank you.
Welcome, Ennelle.
Thank you so much, Dr. Neena. Tina, over to you. Are you there?
Yes, I'm very much there. I just had some network issues and we are back. And thank you, Meghna, for taking the questions meanwhile. We just have about 3 or 4 questions. Dr. Neena, I'm sure we are having about 2 minutes. The time is almost coming to an end, but I hope all of us have some more time for this important conversation here. So just about 2 to 3 more questions. So after recovering from COVID, when should one go, or when can one go and take the vaccine?
Yes, the present guideline, I would say it's the present guideline because guidelines keep changing from week to week. So the present guideline is after 3 months after COVID. So the explanation is you have enough of antibodies till then. You taking it earlier is not going to help you in any way. Take it after 3 months of your infection, of your recovery period. Okay.
Exactly after 3 months, you
can go ahead. Anytime after 3 months, you have a window of 3 to 6 months. So after 3 months, you can go ahead.
Okay, great. And in case the person has taken the first jab and gets COVID positive, so then he has to wait for his recovery and then again wait for 3 months and then get the second jab.
Yes, that would be the ideal way.
All right. Thank you, doctor. And so of course, I came to recovery and then the vaccine, but before that, I wanted to ask, we were discussing about the family members helping and, the neighbors helping there. When can the patient, of course, feels all right, like you rightly said, after 10 days, can he come out of isolation after 10 days or does he need to stay more long? Or, of course, RT-PCR is not required.
You don't want, you don't want to spread it around. So stay in for 14 days. And if your symptoms have lasted a little longer, if it is still gone on in the second week, your physician may ask you to stay even for 17 days. Please do it. It's very, very important because we don't want to spread COVID. We want to contain it. We don't want it to spread. So please do that.
Okay, so once the person comes out of isolation, or like you rightly said, the vacation room, let's not call it the isolation room, the mini vacation room, he does need to wear the mask, and within the family, I'm just talking about home environment. He does.
I would advise to keep it on, especially if you for a week or two more, because especially some patients still do have a residual cough. If you have a residual cough, please keep it on. And the people you need to take care of are the elderly and the young children. So please wear it on for the safety of the rest of the family.
Okay. All right. Another question would be, could there be any complications after the person has recovered fully, maybe after a month, 3 months, 6 months? What do you think?
Most often, no. I wouldn't be able to give you a specific. It could be that they have got the infection from something else. Because one thing I would say is, just like we saw in dengue fever, the patient's immune system is a little low after that. So they tend to fall ill easily. So what would I say? I would say, eat healthy food. Try to eat home food. Don't try going, oh, I've not gone to a restaurant for 2 weeks. I want to go and I want to eat outside food. No, your stomach is you're still in recovery mode. Wait till you're perfectly normal. So eat healthy, eat home food, good home cooked food. Don't take chances with taking chilled things. Stay away from anything cold. Just take care of yourself and see that nothing predisposes you to a cold or a cough. But other than that, you could pick up any other infection. So yeah, you just need to be careful. That's all. I wouldn't say it's a complication of COVID.
So once those 10 days are done and you have recovered, you're feeling fine, you can be, it can come into your mind, you can be confident that you have the antibodies now for another 3 months.
Yes.
And then you can go ahead and take your vaccine. And then, the rest is history. All right, doctor, I think I'll just conclude with this. I think we've covered quite a lot while we were chatting on the questions that we received as well. So we are enlightened with all those questions as well. But lastly, I'd like to ask how I wouldn't say important or comfortable, but how much okay is it to call in the cooks and the maids at home if there is a COVID patient?
Yeah, you could call them back, but only after sanitizing your house. The entire house, after the patient has recovered, see that the house is sanitized completely, and then you could call them back. But continue to wear your mask, because we don't want another person infected and we don't want someone carrying it. You're not going to be infected, but just as a precautionary measure. That's all I'm saying. So when the cook would require to use their mask, cooks or maids would require to help us, would need to wear their masks, and you also wear your mask when they are around in the house, just as a precautionary measure.
All right. So it's absolutely fine to call in the maids and the cooks, the helpers, but it's always better and in fact mandatory to follow the precautions of wearing a mask. And of course, home sanitization services are all available nowadays. There are many companies offering that. So one should also go ahead and get the home sanitized. Great, doctor. It was, I think this brings us to a very enlightened session. And I would really like to thank you and thank all the audience members here for joining in. And just your last thoughts, doctor. What do you think, final thoughts on the home isolation for COVID patients?
Basically, what I would say is, don't be afraid of COVID. Be careful. Very important. And stay calm. It's very important to stay calm. So spread calmness, but not COVID. So if each one is careful, if each one goes home and vows not to take chances, we will be able to contain COVID. It is basically each one needs to take responsibility and be careful not to spread the disease.
That's such a beautiful thought, doctor. Thank you so much. And I'm sure all the audience members here and also people who are going to watch this video are going to be very happy and very relieved after hearing all that you have said. Um, Before we sign off, I'd just like to take about another 5 minutes in case in the audience anybody has any questions and would like to ask.
Can I interrupt for a minute, Tina?
Yes,
Please?
Doctor, please.
Yeah. One thing is that mental health is very important in this time because people are grieving and people are going through different problems. So I do have resources which I have shared with you. Please put it in the chat box that people can use. You can go, and if you're on Instagram, go to the.unopenbox. There's a lot of free resources available. Please go and check it out. You can check for grieving. You need self-care. You have tips for self-care, for your relationships. There are so many free resources there. Just pick out something and help yourself. So, and today, this evening at 3 p.m., there is a Zoom meeting with Leanne Price. She's my daughter, and she's a professional therapist. She's a mental health specialist. You can go for that free workshop. It's a workshop on self-soothing. At this point of time, self-soothing is very, very important. Everyone needs to feel calm. Please go for that workshop, attend it. It would really be useful to you. So I stress on mental health and physical health. Both are equally important.
Great, great. So why don't you, Leanne, tell us a little about this workshop? You're in the audience, so I'd like you to please speak up.
Hey, Tina.
Yes, please go ahead, Leanne.
Mom, thank you. I'm a little caught off guard, but thanks for this. Yes, we are having a workshop today. And please do show up. It is about self-soothing. It's entirely practical. And the idea of it is there's enough PPTs out there about self-soothing, but no one's really talking about how to do it and how to go about it. So what I'd say is join in, because we're doing it practically. We're teaching you stuff that you can actually use at home. You don't have to pay money for it. You don't have to do anything extra for it. You just use your body. You use techniques we teach you to actually connect with yourself and take it forward. So that's our hope from today. It's just 1 hour, 3 to 4 p.m. So if anyone is interested, please join in. I promise it's going to be good. Yeah. And you've seen my mom. So I'm hoping you'll realize I've got something from my mother.
Oh, of course. It has to be coming from the genes, Leanne. So
thanks,
great.
Tina. This is so lovely.
Yes, it's absolutely beautiful to see the family, doing such a good work for the entire society. It's commendable. Seriously, it's commendable.
Thank you.
Right. All right. So all of you out there, if you want to help yourself get mentally calm, and as the workshop title suggests, it's soothing, right? Mental soothing. So I think all of us, if we don't require it, we at some point in time, we might require it for our loved ones. So it's very important either ways to attend such workshops, because in today's world, I think mental health has become the priority, especially the pandemic session, because of the pandemic, and otherwise also there's a lot of stress in our lives. So I think this session is also going to help you, just like this talk session with Dr. Nina has helped us so much. Right, Doctor? Anything else, Doctor, you'd like to conclude with?
Nothing. Thank you. Thank you for giving me this opportunity. I'm happy that I could share some of my experiences with the audience.
Absolutely, Doctor. Experiences and the knowledge that you have, shared with all of us today is definitely going to be a lot helpful, not only for the audience out here, but also for the people who are going to be seeing this video. And I'm hoping that it gets viral as soon as possible, because this is the need of the hour nowadays. So yes, I really hope so.
Thank you.
Right, Doctor. So Meghna, would you like to say anything before we sign off?
Yeah, I would. I completely enjoyed the entire workshop. Also the session, and we have also shared the link of Liana's workshop to our council members, so that they could also be a part of it. And I would like to really thank Dr. Nina for sharing such great insights. They were really useful. And to all the participants who could make it on a Sunday morning, because I know that, for most of them, taking out time on a Sunday morning is usually difficult. But thank you everyone for being a part of the program and session. And we will continue to hold many more sessions every week. So on the themes that are of common interest. So in case, you are interested in attending any particular kind of a session, uh, do drop us a message so that we can look for experts from that area who could share their insights on a particular theme. Yeah, that's it from my end, Tina.
All right, all right. Thank you so much, Meghna. And yes, as Meghna said, Dr. Meena, we have already shared the workshop of Leanne's workshop, Mental Soothing, on our group. And of course, the resources that you have shared with us, the Instagram handles and the YouTube videos, we will also be posting that right after posting this video, because there has to be a connection. The purpose that we are doing this talk session, there has to be a connection. So we will be doing this. I think this is going to be our Sunday job, or maybe up till Monday morning. We are going to be busy with all that.
Would also invite everyone to join our Instagram and social media handle of WICCI Delhi Startup Council to stay updated on all the upcoming sessions, and to also engage with us in any council meetings that we keep holding every week, to share your challenges, your insights, and in case you need any kind of help from our end.
Yes,
thank you, Meghna.
All right. Thank you so much, everybody. And this is all for this session.
Thank you.
Thank you. Have a good day. Bye-bye.
Thank you. Bye-bye.